Hey family, welcome back. So this video is going to be about increase compared to secondaries. The reason why this video is so important is because there's so many veterans out there that I know personally that have been trying for years to get their increase taken care of. And a lot of the times when you go to get your increase, you can actually get a decrease. And that's actually on another one of the videos on my channel you might want to check out. So let's talk about increase versus secondaries. Okay, so there's a few things you got to take in consideration. I'm going to make this quick, okay? A few things we got to take in consideration is how long have you been trying to get an increase? Have you ever filed for a secondary? What are secondary conditions? Where can I find out what a secondary is? Now, I'm always trying to give you the information on where to find it. Now, we've talked about the ECFR several times and how to go about it. You can Google ECFR, go down to Title 38, which is the veteran pensions, things like that. You're going to click on 38. You're going to click on Chapter 1, you'll see it, and then you want to go down to 3. Remember, I always say 3, 4, and 17 are basically the most important ones. So this, whenever you're dealing with the secondaries, that's going to be ECFR Title 38, 3, and then go to 310, and that'll explain everything to you. What secondary and what secondaries are. I'm sorry, I'm trying to make this quick. So here's the thing. When you're dealing with an increase, you've got to increase your meds. You've got to increase your treatments. You got to increase your appointments. You got to increase your walk-ins. You got to increase. And a lot of times they will, they take quite a bit of time, right? There's been a lot of veterans that I've helped who have done all that, and then they end up getting a decrease when they file. Because whenever you file for an increase, they're actually going to look at everything that you have as far as your disabilities. So if you have about, 5 or even more disabilities that you've claimed you're getting a percentage on, and you're focusing on this one thing to get the increase on, you're basically going to be doing the Robin Hood effect. It's going to be taken away from the rich to give to the poor. But the thing is that if you're focusing on this one thing to get the increase, and you haven't been to the doctor in 3 to 5 years for these other things, you'll probably get a decrease overall. You might get an increase 10, 20% on that one thing, but may lose 30 to 40 on each of these others. It's happened, and that's all I'm saying. So what can we do? Because I know a lot of veterans are out there hurting, they can't work, and they're only down to like 30, 40%. They're barely making it, struggling. I'm not going to tell you how to manipulate the system. I'm going to tell you what is going to be the better of the increase compared to the secondaries. So on the ECFR Title 38 3.310, that will explain what the secondaries are. So what does the VA consider it a secondary condition? According to the VA, it is a physical or psychological problem that is worsened by a service-related disability. Okay, for me and you, okay? What that means is if you hurt yourself, let's say it's a back injury, okay? And with that back injury, now you claimed and you've got a lower back strain. Well, now, because you got that, instead of trying to spend years and years and years of increasing it and not really understanding how it works, you could probably even go to physical therapy, which now you're doing all the rowing and the biking and the lifting. That's really not going to be a lot of good evidence considering that you have a back problem and you're doing all this physical treatment, physical therapy, right? If you're physical, your back's probably not really that hurt. So quit trying to toughen it up and be honest and just tell them how you hurt and everything. Instead of spending the time and the years of doing an increase, you could just be seen and talk to your doctors about the secondaries, the things that's going on. And we're just using the back as an example. Okay, so you have lower back strain. Well, you could possibly have arthritis, sciatic nerve, the radiculopathy, the electricity, the pulsating pain going up and down your legs, not to mention any kind of heat or anything that you feel in your back. And that can also bring depression, anxiety, things like that. So there's the secondaries, right? Instead of fighting that one increase, right? Go ahead and make your list of your 4 to maybe 10 secondaries and be seen from the doctor. So now you have that medical evidence. If you have a private doctor, you could actually even get a nexus letter. But state how it is service connected and not just how you hurt. One way to really help you with this is when you see your doctor, use the word because. That is a very important word, because. So if I have, and we're just going to throw this out there, if I have insomnia, well, I can't sleep because I toss and turn all night because of my back, the arthritis and my back strain. So I'm not able to sleep because of my back. I'm having migraine headaches because I'm not getting any sleep. I'm having anxiety because when I drive and I see roadkill, I see an EID. You have to use that word because. If you go to the doctor and you say, hey, I'm having migraines. Okay, you're having migraines. But okay, here's some whatever. Now go, take your meds before you go to bed. Take some Tylenol, PM, whatever. That'll take care of your migraines and insomnia. You'll be able to get to sleep. I'm having this because of my PTSD. I'm having this because of my injury, because of my burns, because of my, colostomy bag, because of, you use the word because. You see how that's connecting? Okay, let's move on. Examples of secondaries could be arthritis, pain, ulcers, fatigue, depression, urinary tract infections, which is extremely common. Let's see. So yeah, there's just an entire list. Even like breathing problems could be secondary to a lung condition or lung disease. So this is why that you need to have a doctor that you can trust. And you can actually scroll down my channels and see how to talk to your VA doctor. And that'll explain more. And then some common type 2 conditions, not type 2, I'm sorry, I was thinking type 2 diabetes with Agent Orange, excuse me. So some of the common secondary conditions, hypertension, chronic pain, skin sores, UTIs, respiratory infections, weight gain, social isolation, ED, things like that. So I want you to think about this. I want you to make a list of some of the things that you may be suffering from secondary, and all this time you're focusing on getting an increase when all along you could have already had your secondary. Now, we talk about some of the trigger words and how I tell you that severe is pretty important, a really important word. I was going through the ECFR, and you guys will see this when you go to it. Title 38, Chapter 3, then 310. We're talking about the secondaries. So here we go with my video editing. See how that is mild, moderate, and severe? This is one of the tables that you will even see on the Title 38, 310, talking about secondary conditions. So I want you, if you don't have severe now, you will eventually. These things aren't going to get better, and only time is going to make them worse. And, so if you have plenty of time and increase, I say go for it. If you are to a point where you're not being able to eat and feed yourself and pay your bills, not being able to work because of your primary conditions, definitely, well, regardless anyway, but most importantly, do file for those secondary conditions. So once again, what you can do is if you even just type in, if you Google, VA secondary conditions or secondary conditions of VA disability, you will see it'll pull up on, matter of fact, I'll do it right now. I'll show you how fast it takes. It's only going to take a second. So I'm going to type in blah, 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 VA secondary disability. It's already giving me all the information that I just told you. And what I like about this is that people also ask. So these are going to be questions. Give me just a second. I'm trying to focus in on this. It's going to say people, what they commonly ask. What are examples of secondary conditions? What are secondary disabilities? What is needed for secondary VA claims? And they just go on and on and on and on and on. As you answer one, so let's answer one, okay, or let's ask, what is needed, okay? Medical records, okay, duh. Well, as you go down, now it's going to give you even more options of, now it goes to easiest secondary VA claims. So let's click on that. So we go to easiest secondary claims, and this is another way how people get, their YouTube. They'll just go ahead and click on that. But when we did that, it's path to 100% disability, backdoor to 100% rating. I don't know about all that. Okay, easiest secondary claims. It goes straight into PTSD, tinnitus, migraines, mental disorders, scars, depression, hearing loss, limitation of ankle motion, and it goes on and on and on and on and on and on. And then it goes to people also ask, how do I win a secondary claim? What are the top secondary VA claims for PTSD? So instead of getting confused with the YouTube channels going back and forth, and they're going through the same thing over and over and over and over. I was going through some of the channels and just seeing what was going on. And there's some people, I'm not going to pick on anybody, they have the same videos, just even almost the exact same titles, but a different thumbnail. And it's the same exact videos over and over and over and over and over. The same information, You're wasting your time by watching the same thing over and over and over and over and over and over, unless you really want to learn it where you can facilitate and teach it yourself. Anyway, but that's you. So go to the ECFR or just go ahead and type in, Google whatever you want, and all the questions that you have and you're waiting for these videos to answer, you can get them answered right then and there if you just scroll down. And I'm going to go ahead and pitch my book again, 100% Faith, 0% Fear. Go ahead and pick yours up, email me, and $12, I'll get it sent to you. All proceeds go to the Anchor House for Veterans, Anchor House for Veterans. It's also the Anchor House for of East Texas. And you guys, I have a video about that if you guys want to see that. If you would, please like, subscribe. Subscribing is extremely important. Like, subscribe to keep this going. Go through my channel. If you find value in this video, go through the channel and see some other videos that could probably help you. I know this is kind of dumb, but the Elvis video, watch the whole thing. It's kind of funny, but anyway. But remember to like and subscribe. And if you guys have a video that you want me to go through the ECFR and learn about the information and blah, 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 if you're having a question or concern, let me know. I'll make a video about it. And once again, this was Increase versus secondary conditions. I wish you all well. Have a good one.